Assalamu alaikum. I am Dr. Ruqia, counselor from the Department of Community Medicine, and today we will be discussing about adolescent health. In this presentation, we will be discussing about what are adolescents, what are the stages of adolescence, what is the importance of adolescent health, what are the various health problems which are encountered during adolescence, and what are the various adolescent health programs. What is adolescence? It is originated from a Latin word adolescere, which means to grow into maturity. It's a phase of human development which shows the transition from childhood to adulthood. As per WHO, adolescence is an age group between 10 to 19 years of age for both females as well as males, whether married or unmarried. Adolescent is the age group from 10 to 19 years. Youth is the age group from 15 to 24 years, and young people is the age group from 10 to 24 years. And thus, these adolescents are no longer children and are not yet adults. What are the different stages of adolescence? Earlier adolescence. It is the age group from 10 to 13 years, and it is characterized by a spurt of growth and the beginning of sexual maturation. The people start to think abstract. Mid-adolescence. It is the age group of 14 to 16 years. It is the stage where main physical changes get completed and the individual develops a stronger sense of identity and relates more strongly to his or her peer group, and thinking becomes more reflective. Late adolescence. It is the age group of 17 to 19 years. The body takes its adult form while the individual has a distinct identity and more settled ideas and opinions. Now the question arises, why is adolescent health important? Because it is the stage where major physical, psychological, and behavioral changes take place. It is the stage where sexual maturation and onset of sexual activity takes place. The child develops an adult mental process and adult identity. It is a stage of growth spurt and thus increased nutritional needs, and the child becomes physically active and more independent. WHO says that these adolescents are unique and thus it's important to make health services adolescent friendly because they need quality health services that recognizes their issues, like they don't want to be treated like a child, that their privacy should be respected, and they want to have a say in decisions regarding their health. Globally, around 1 in 6 persons in the world is an adolescent. That accounts for 1.2 billion people in this age group. Mostly they are healthy, but there is still significant death, illness, and disease among adolescents. Thus, it's important to promote healthy practices during adolescence, and steps to better protect young people from health risks are critical and crucial for the prevention of disease in adulthood. Globally, around 3,000 adolescents die every day, and nearly all these deaths are preventable. Top 5 causes of death as per WHO are road traffic injuries, pneumonia, which include other lower respiratory tract infections as well, suicide, diarrheal disease, and drowning. As per WHO, during 2016, around 1.1 million adolescents died that year. Among boys in the age group of 10 to 14, main cause of death was road injury, and it was same for the age group of 15 to 19 years. Among girls, For the age group of 10 to 14 years, HIV/AIDS was the main cause of death, and from 15 to 19 years, maternal conditions were the main cause of death worldwide. Coming to the Indian scenario, around 23% of the population of India are adolescents. Half of them is sexually active before marriage. Fertility rate is high in adolescents and thus may lead to increased maternal mortality ratio and infant mortality rate. These adolescents have low knowledge about family planning and healthy sexuality. Coming to the changes which occur during the adolescence phase, there is physical growth, psychological growth, and sexual growth. The physical growth comes as secondary growth spurt. There is increase in the adipose tissue in girls and increase in the muscle mass in boys. Psychologically, they become as grown adults. There is increased need for privacy. They have lack of impulse control and risk-taking behavior. Sexually, there is growth of primary as well as secondary sexual characters. What are the sexual changes that occur during adolescence? In males, primary sexual characteristics appear. Penis and testes enlarge, sperm starts to be produced, and secretions are released from the prostate gland. There is growth of chest, pubic, and armpit hair. Voice deepens because of changes in the larynx. In females, ovulation occurs, menstruation begins, and uterus and vagina grow. Breasts develop, there is growth of pubic and armpit hair. There are body changes like hips widen and waist narrows. Now, what are the physical implications of these different changes that occur during the phase of adolescence? Since it's a normal growth during adolescence, but it may lead to undue anxiety and tension. There is increase in height and weight, which may increase the nutritional requirements for them. The breast development in females may lead to stooping of shoulders, poor posture, and back pain. The skin becomes oily, and which may lead to the development of acne. There is desire to be thin and have a good figure, which may lead to protein energy malnutrition and anemia. There is desire to have sex, which may lead to unsafe sex, leading to unwanted pregnancies, sexually transmitted infections, and transmission of HIV/AIDS. Because of the ejaculation, there may be fear, guilt, myths, and emotional problems. During menstruation in girls, there may be dysmenorrhea, menorrhagia, poor menstrual hygiene, which may lead to sexually transmitted infections. The emotional changes and social developmental changes which occur may lead to confusion, moodiness, and irritation. The adolescents are very curious, which may lead to experimentation and risk taking behavior. There is lot of peer pressure during this adolescent phase, which may affect the lifestyle. Now, coming to the adolescent health problems. They are broadly divided into four categories: nutritional problems, reproductive problems, mental health issues, and behavioral problems. First are the nutritional problems. The desire to be thin and have a good figure may lead to poor nutrition and thus leading to undernutrition. And there may be iron deficiency anemia because of poor nutrition and obesity or eating disorders like anorexia nervosa and bulimia. Coming to the reproductive problems. The desire to have sex may lead to teenage pregnancies, which may lead to abortion related problems, reproductive tract infections, irregular menstrual cycles, and sexually transmitted disease. Mental health issues may include depression and suicide, as they may not be able to come up to the expectations of their parents and be equal to their peers. Psychosis, mania, conduct disorder, and anxiety disorders. Behavioral problems include drug experimentation because of their being very curious, substance abuse, risk behavior, violence, and bullying. Coming to the adolescent health programs. First is the Kishori Shakti Yojana. It is a scheme that targets adolescent girls in the age group of 11 to 18 years and addresses their needs of self development, nutrition, and health status, literacy, and numerical and vocational skills. Sabla scheme. It was started by the then Prime Minister of India, Rajiv Gandhi, for empowerment of adolescent girls for the age group of 11 to 18 years to improve their nutritional and health status. And both these schemes are now implemented through the infrastructure of Integrated Child Development Scheme. Then we have the nutritional program for adolescent girls, Integrated Child Development Scheme, and RMNCH plus A strategy. The nutritional program for adolescent girls was approved as a pilot project for the year of 2009 to 2010. It was started in 51 identified districts, and the undernourished adolescent girls in the age group of 11 to 19 years were given 6 kgs of free food grain per month. Body weight less than 30 kgs for 11 to 15 years of age girls was kept as a criteria for undernourishment, and 35 kgs for 15 to 19 years of age was criteria for this age group. Integrated Child Development Services. It was started initially by the Department of Social Welfare in 1975 as an experimental project in 33 areas. Later on, it was expanded to 100 areas. Seeing the success of these two projects led to the development of this integrated child development services for the whole of India. Initially, Government of India provided all the provisions for supplementary nutrition, but later it was decided that 50% of the costs will be borne by the state government as well. Now, what are the different beneficiaries and the services given to them? It includes pregnant women, nursing mothers, children less than 5 years, children between 3 to 6 years, and adolescent girls of the age group of 11 to 18 years. For the adolescent girls, we have supplementary nutrition and health education. The last program which we will be discussing today is the RMNCH plus A strategy. During June 2012, the Government of India, Ethiopia, USA, and the UNICEF convened the Global Child Survival Call to Action, a promise to keep a global summit at Washington, D.C. to energize the global fight to end preventable child deaths through targeted interventions and life saving interventions. 8 months after this summit, in February 2013, the Government of India launched a strategic approach to reproductive, maternal, newborn, child, and adolescent health (RMNCH plus A), and since its start, it is under the flagship of National Health Mission. This RMNCHA plus A strategy uses a 5 into 5 matrix for high impact interventions to be implemented with high coverage and high quality. And these interventions have to be used in different stages, 5 stages, which include reproductive health, maternal health, newborn health, child health, and adolescent health. Now discussing the 5 into 5 matrix for RMNCH plus A strategy. Its main goal is to make every mother and child healthy, and the various interventions are used at different stages like reproductive health, maternal health, newborn health, child health, and adolescent health. And also, it includes the improvement of health systems and various cross cutting interventions to improve the overall health of the females. Now, what are the different priority interventions in the RMNCH plus A strategy program? These include adolescent nutrition, iron, and folic acid supplementation. Second is the facility based adolescent reproductive and sexual health services, that are ARSH clinics. Third is the information and counseling on adolescent sexual, reproductive, and other health issues. Menstrual hygiene and preventive health checkups, which are given to these adolescents. Now, coming to the adolescent reproductive and sexual health program, also known as ARSH. It focuses on reorganizing the existing public health system in order to meet service needs of adolescents. It includes improved service delivery for adolescents during routine subcenter clinics and ensure service availability on fixed days and timings in primary health centers, community health centers, and district hospital levels. The core packages in this program include promotive, preventive, curative, and counseling services. First is the facility based, adolescent friendly health clinics. During these clinics, routine checkups are done at primary, secondary, and tertiary levels of care at fixed day clinics. They provide information and services and commodities for varied health related needs such as contraceptives, management of menstrual problems, reproductive tract infections, sexually transmitted infections, and antenatal care and anemia. Facility based counseling services include counseling for important issues like nutrition, puberty, reproductive tract infection and sexually transmitted infection prevention and contraception, delayed marriage and childbearing, concerns related to contraception, abortion services, premarital concerns, substance misuse, and sexual abuse and mental health issues. Third are the outreach activities. They are conducted in schools, colleges, teen clubs, vocational training centers, during village health nutrition days, health melas, and in collaboration with self help groups to provide adequate and appropriate information to adolescents. The advantage in these outreach activities are that a large number of adolescents can be counseled at a single time. Then we have the weekly iron and folic acid supplementation. It is launched by Ministry of Health and Family Welfare to meet the challenge of high prevalence and incidence of anemia amongst adolescent girls and boys. The long term goal is to break the intergenerational cycle of anemia, and short term benefit is to improve the nutritional capacity of humans. It is given as a single tablet daily and it's of blue color. As we already know, the iron tablet which is given to pregnant ladies is red in color, but in case of adolescents, it's blue color tablet. Now coming to the menstrual hygiene scheme. The Ministry of Health and Family Welfare has launched a scheme for promotion of menstrual hygiene among adolescent girls in the age group of 10 to 19 years in rural areas. It aims at ensuring that the girls have adequate knowledge and information about menstrual hygiene and have access to high quality sanitary napkins along with safe disposable mechanisms. And the sanitary napkins are called as free days, which are given by the ashas to these adolescent girls. Now, what are the key activities which are taken in this menstrual hygiene scheme? These include community based health education and outreach in target population, ensuring regular availability of sanitary napkins, sourcing and procurement of sanitary napkins, storage and distribution of sanitary napkins, training of ASHA and nodal teachers in menstrual health, and safe disposal of sanitary napkins. At the end, I conclude my presentation on this note. Adolescents are the greatest resource for a society to thrive. Investments in adolescents bring a triple benefit. Healthy adolescents now become healthy adults in the future and thus giving rise to healthy future generations. Thank you.